next step to a happier, healthier life. Let's get started. The mini gastric bypass procedure is performed laparoscopically, which is a surgical technique where only small incisions are made. The laparoscope is inserted through a small incision in the abdominal wall. The camera sends images to a video monitor, which allows your surgeon to see inside your body without having to make large incisions. Laparoscopic surgery is a low-risk, minimally invasive technique with many benefits, including smaller surgical scars, less pain, shorter hospital stay, faster recovery, and reduced risks of infection. The mini gastric bypass has two parts. First, we divide the stomach into a smaller portion, or pouch, that is approximately 1/4 of the existing stomach. The second part involves joining, or anastomosing, the gastric pouch to the small intestine, leaving approximately 200 centimeters of the small intestine above the new anastomosis. The small intestine is the part of the GI tract that is responsible for the final breakdown and then absorption of the food. This results in the majority of the stomach and approximately 1/3 of the small intestine being bypassed, meaning it is not involved in the digestion or absorption of the food you eat. Studies have shown that, on average, a patient who has the mini gastric bypass procedure will lose up to 75% of their excess weight, and that most of that loss will occur in the first year. For the majority of patients, the weight that is lost stays off. Our goal is that you lose 2 to 3 pounds per week. At that rate of weight loss, you will burn fat and maintain or even increase your muscle mass. The mini gastric bypass procedure works in two ways. One is that when you eat, the pouch of stomach that's left behind fills. Filling that part of the stomach sends signals to the brain that you feel satisfied and comfortable with smaller portions of food. The second reason the mini gastric bypass is so effective for sustained weight loss is that in bypassing a section of intestine, absorption of the food you do eat is reduced. The mini gastric bypass is both safe and effective. There is just one anastomosis of the intestine to the stomach, which differs from the Roux-en-Y gastric bypass, which has 2 anastomoses. The single anastomosis reduces the risk of complications, including hernias, leakage, and bleeding. The MGB procedure has been shown to lead to fairly rapid solution of diabetes, mostly as a function of the bypassing of the first part of the small intestine.